The Buck Institute is honored and proud to provide the public with scientific, evidence-based information on the COVID-19 pandemic. Because the Buck's mission is to end the threat of age-related disease, we are particularly focused on the fact that COVID-19 disproportionately impacts older adults. Our webinar series includes researchers working to find a cure for COVID-19.
But if you know what the target is, and we think we do, and that being sigma R1 and R2, that's how you make the connection.
Because a virus that has very high mutagenic rates and variability in its sequences are much harder to capture in a vaccine.
We also talk about epidemiology and public health.
It's really important that we answer the question, not just for what we can do, but what we should do.
We're going to need to identify everyone who is productively infected, so we will need these tests.
And get advice from a physician who cares for older adults.
There's all sorts of ways that we can stay socially connected and socially together while staying physically distanced.
What do we know about COVID-19? How is the fight against it going? What's next? And what does it mean for you? Here are some answers.
The older you are, the more you are at risk, not so much for the infection, but for the bad complications and the fatalities associated with the infection. But again, it's not only in older people. It turns out that obesity is also a really high risk factor for complications. And so are a number of chronic conditions that we have known for a long time to be a number of chronic conditions associated with aging.
The virus cannot exist by itself. It can't live. It needs our cells, our genes, our proteins in order to live and replicate and infect our cells. So the way it does that is it hijacks and rewires our machinery, our proteins. We're trying to identify the human proteins that the virus needs to infect us, and then let's pharmacologically target those human proteins. And there's advantages to that strategy. One, we don't mutate as fast as viruses. So one of the issues about having drugs that target viruses is that you get mutations and then you get resistance.
Many of our listeners have probably heard of this concept of inflammaging, the idea that dysregulated, abnormal, not productive inflammation can increase as we get older. And in very subtle ways, but in subtle ways that we now think contribute to many of the chronic diseases of aging. Inflammation is a good thing when our body is using it to heal ourselves. If we have a cut, if we have a surgery, we need inflammation to fix things. But when inflammation gets uncontrolled and can't get turned off, that causes problems. So older people's immune systems are in this strange state where they're always a little bit too active and causing this inflammation. But then they have a hard time ramping up when they're supposed to fight a virus. Our body temperatures tend to drop as we get older. So our normal temperature, everyone probably remembers learning as a kid, our body temperature is 98.6 degrees Fahrenheit. That's not the case for older adults. Our normal body temperature actually drops. And so if you see a normal temperature in an older adult, it might actually be a fever if it's a couple of degrees above where they normally are. And older adults don't generally mount fevers as readily as younger people. So you often don't see fevers, or you might miss them because they look normal, although they're not. And older adults tend to present in confusing ways, often very subtle ways. An older person might just be a little bit off, maybe get a little bit confused. Even if their brain is normal, we're not talking dementia or anything, or being a little bit lethargic, more tired, not eating. These sorts of subtle, non-specific kinds of symptoms are actually really common in older adults, and especially from infections.
The virus is really a master manipulator in the cell and in the body. And I think we have to understand it on a cellular level, but also on an organismal level, where we really understand how, in the cellular level, we know what the virus does to a cell when the cell enters, but we can also learn what it does to the neighboring cells that might get all its guards up and prevent infection. Fat is actually a dependency factor, or can be supporting the virus. It's also a huge energy bowl where the virus can access energy for its own replication.
Everything we do to use a mask, to wash our hands, is to remove ourselves from the number of susceptibles. Everything we do by social distancing is to remove the population from that list of susceptibles. It doesn't stop or reduce the total number of cases. If you like calculus, if you see that curve, you're going to be pushing it, far to the right, but the area under the curve, the integral, stays the same. The number of cases doesn't change. We're hoping we can postpone it until the cavalry comes, and the cavalry is the vaccine.
We are actually at an enormous pace currently with the vaccine development compared to other vaccines that we have developed in the past that takes years to do. The remdesivir study is also a pan-antiviral in some sense because it was developed against another virus and is currently being used, against the SARS-CoV-2.
Nevin and his colleagues were able to do this and to identify a large number of cellular proteins. And it turns out, quite interestingly, that many of these cellular proteins are proteins that we know at the buck are involved in the aging process. And so this led to the identification of a number, actually 69 potential drugs that we know interfere with these processes that are currently being tested at the Pasteur Institute and at Mount Sinai in New York. Some of your listeners might be familiar with rapamycin. This is a drug that is currently being explored as a drug against the aging process. It targets a cellular protein called TOR. It delays aging, and this was identified as one of the promising potential drugs. Now, there's some worries about rapamycin because it is also at high dose as an immunosuppressant. But there's early evidence that at low doses might actually have a very beneficial effect on the immune system.
And we've reported on this in the past, is you see these commonalities as you go across different viruses. You see the same proteins being hijacked and rewired as you go across, RNA viruses, DNA viruses, lentiviruses. But if you take a bigger step back, we're also using these approaches on a variety of other diseases like cancer and neurodegenerative disease and heart disease. You actually see amazing commonality there as well. At the end of the day, it's probably going to be a mixture of approaches that'll be brought to bear to help out here. And it could be, with respect to therapeutic approaches, maybe a drug and an antibody or something, or as you say, maybe there'll be a vaccine for a certain subgroup and there'll be a therapeutic for another subgroup of individuals that are older or don't respond to the vaccine. So that's why it's so important to keep pushing on the research on our fronts, because you don't know what's going to break out and be the most useful.
A vaccine would be fantastic, of course. If we can slow this down until we get a vaccine, that would be great. But we can't count on that. So the other option of just letting everyone get it, this idea of herd immunity, to me is really scary, because this isn't a cold and it's not the flu. A lot of people who get this die, and a lot of people who get it who survive will be disabled, and we should talk more about that.
It turns out that for the last 30 to 40 years, the science of epidemiology and the science of public health, our public health systems, have been not paid attention the way they should be. These represent significant investments, obviously, but they pale in comparison to the amount of money that we have to spend now. So an ounce of prevention in this case is just exactly what we need.
And today, no, I don't think you should, because it's against the rules that we've agreed to follow. But when things are opened up, I'm afraid those rules may be vague and open to interpretation. And this is where we have to ask you and me to be the best version of ourselves that we could be. One of my highlights from this difficult time are the people who have a hashtag called "I'm wearing this for a friend," and then a picture of a mask.
I think is a great time to think about how to make your exercise program work for you at home, and work for you in a way that doesn't put you in contact with too many other people. So a lot of us have been exploring our neighborhoods, for example, and learning how to distance ourselves as we're walking around the neighborhood. That's a great thing to do. Walking is really the best exercise. And if you're fortunate enough to live in a house with enough space to do a lap, start counting those laps. If you have a backyard, even better. If you don't, any sort of exercise is better than none at all. We don't want to become couch potatoes, because we know that's going to harm our long-term health, even if we don't get the virus. Figure out how to connect with your family and your friends as much as you can without physically being together for a long time. And get creative about this too, about videos and about meeting across a door, meeting over a fence, doing things online together. There's all sorts of ways that we can stay socially connected and socially together while staying physically distanced. And this is the time when we all need to figure out how to do that.
I hope you enjoyed hearing from these experts. If you'd like to hear more, you can view their complete interviews on the COVID-19 page at buckinstitute.org. We will continue to do additional webinars as the COVID-19 pandemic plays out. Archived webinars and upcoming sessions are and will be free. You just need to register at this website. If you support the Buck's work, please consider donating to our COVID-19 Research Fund. Science exploring the coronavirus and how it impacts our bodies is what will ultimately bring this public health crisis to an end. We depend on your generosity. Thanks for whatever you can give. Stay safe and healthy, and I hope you can join me for our upcoming webinars.